Welcome to Raaonline. Today I will be speaking on evolution of lumbar disc surgery. So as you know, it was on early 1894. That was the year when spine surgery was actually invented. The first procedure was performed by none other than Victor Horsley. So here you could see him. This was a case of a spine tumor and that was diagnosed by early radiograph. And then he recognized that it is actually a cascade of a degenerative process of the lumbar spine, and that's when he has done the first laminectomy in history. So that's how the spine procedure started. So my agenda of talk today is how we evolved over the lumbar disc surgery. So I'll be starting with a basics of lumbar disc anatomy, followed by open procedures, followed by minimally invasive spine surgery, how it has evolved slowly over generations. So this actually I have taken from a neurosurgical journal where you can clearly see that before 2000 we had only one way of accessing the disc. So that is through performing a laminectomy and going in the front, retracting the thecal sac, growing in the front and removing the disc. So over the last 2 decades, the spine surgery has been evolved significantly. Here you can see the role of endoscope coming in, the role of microscope coming in. All this was evolved over time in India. So going with basics anatomy, so you know cervical, spine, it starts from cervical spine to coccyx. Cervical spine has 7 vertebra, the thoracic has 12 vertebra, the lumbar has 5 vertebra, then there is sacral segments, then there is coccyx. So this is a magnified view of lumbar vertebra. Here you can see from L1 to till S1, and these are the exiting nerve roots at each level. And you can see the disc space between L1, L2, L3. So this is the disc. Now you know from my previous class, the disc contains 2 components. One is annulus fibrosus, which is the covering, and inside it contains nucleus pulposus. Now pulposus is the one which has more than 85% water content when you are born, and then it slowly degenerates over time as you age. Okay, so the same thing. So the spinal cord usually ends at L2. Okay, all this what you're seeing is the caudal nerve roots, or you also called as quadra equina, tail of a horse. Okay, so as I said, the intravertebral disc anatomy is nothing but you have annulus fibrosus and you have nucleus pulposus, 85% water content at birth, which slowly degrades over age. Okay, and here you can see the epidural fat, which is marked by yellow, and you can see the thecal sac, which contains the quadra equina nerve roots. So what you called as a functional unit. So this is known as functional unit. Okay, a functional unit is nothing but you have the above vertebra, the below vertebra, the disc, which contains the annulus fibrosus and the nucleus pulposus, the foramina, the facet, okay, the facet joints, the spinous process. So this produces degrees of movements. So that's why this is called as functional unit. When you are talking about functional unit, all this space between 2 vertebrae, disc is involved, the above and below vertebra is involved, and the facet joints which helps in movement, everything is involved. So that's called as a functional unit. So disc is a primary supporting, disc and the vertebral body are the primary supporting supporting measures of your spine. What are the secondary supporting measures? The secondary supporting measures of the spine is nothing but the muscles. Okay, if your abdominal core muscles is strong and the back muscles is strong, the chance you can actually delay your degenerative process because the loading of the spine reduces thereby. Okay, so what are the muscles involved in secondary stabilization? Okay, here you can see iliocostalis group, the longissimus group, all this form the core back muscles. Okay, if this is very strong, the loading on the spine reduces and thereby reducing your degeneration. Also the small muscles are also equally important, the intertransverse muscles. Okay,